Zena, you good?
You'll give me a minute, I'll be all good. Thanks, sorry.
It's all good. It's all good.
It should be good.
Just wanted to make sure. All right. Everybody else good?
You good?
Awesome. I'm great after this morning.
Me too.
All right, we'll kick this thing off. Good morning, everyone.
Good morning.
Today is a significant milestone in the tragic journey that we know about with 29th and Grove. I want to first say thanks to the Sunflower Foundation, Stand Together, Blue Cross Blue Shield of Kansas, Fidelity Bank, the Wichita Foundation, Kansas Health Foundation, Sedgwick County, as well as the City of Wichita. We have met the $1 million match. That is big news, and we are truly excited about that. Thank you. I have always said that with the right plan of action, the funding would follow, and today is a testament to that. We are grateful to the state legislature and Governor Kelly for approving the funds to help get the people the answers that they deserve regarding the impact that TCE and PCE may have had on them. For the last 3 years, we've heard heartbreaking stories from the community and frustrations from the community about how this has impacted multiple generations of families. I've personally heard the stories about lost loved ones and others about people who've suffered for years with cancer and other illnesses. Shockingly, we even met a family in this journey who owned a home that was still solely using well water, but luckily that's been resolved now. And while I don't always talk about my family and personal connections in situations like this, I do have one. My great uncles, Robert and Curtis Perry, lived at the 2200 block of North Poplar. And I spent a lot of days there as a young person, as well as some time near the spill site, playing with other neighborhood kids. You know, you back there, you're not supposed to be, but we did it anyway. Both of them have since passed, and one of my uncles actually did have kidney issues. So this is personal for me. This tragedy touches us all, though. It shouldn't have happened in the first place. And I'll stand by that. It should not have happened in the first place. It happened in a community that continues to navigate various negative economic, environmental, and health issues to this day. It should not have happened in the first place. With the situation of this magnitude, this community deserves a fact-based response that acknowledges the harm that has been caused by the spill, the health implications of the chemicals in the soil and water, acknowledgement of any and all funds received and how they will be used, and most importantly, a well-thought-out, collaborative plan that addresses the screening and testing needs of the community. That is why we work so hard with KDHE and Union Pacific to host more public meetings and increase in community engagement. That's why I always insisted as well that we have a collaborative plan of action that involve the medical professionals and community health organizations to address this issue in a way that will ensure that people can get the answers they deserve regarding their health, and that we see the corrective action decision through to begin the final phase of remediation with Union Pacific. And I want to be clear, today, April 25th, 2025, the groundwater is still contaminated, and so is the soil. So do not use the well water. It is still contaminated. And again, so is the soil. And it will be that way until the approved remediation plan is constructed and operational. So again, if you have well water, if you're using well water, you should not drink nor play in it. Do not use the well water if you live within the plume area. Now, we are working with Union Pacific to get to the point of final remediation. Our Public Works and Utilities team has been actively working directly with Arcadis and Union Pacific on the necessary approvals, as well as work plan, design, timeline, and locations of the remediation devices. And we still are working with them to this day. My goal, our goal, is to get the approvals complete this year, in 2025. That means construction started this year, and those devices fully operational by the first quarter of next year. It needs to happen. That 10-year cleanup window will not start until those devices are in the ground. We want that to happen this year. Union Pacific will be soon announcing another public open house that will be scheduled for early summer, where they will offer more details of where they are and a hopeful timeline for the community for remediation. As we move into the implementation of our collective plan, I do want to take a moment and thank someone very important and special. That is Venus Lee. Venus Lee and Grace Med took immediate action when I called her and told her what was happening and told her that we had this troubling thing and I didn't know what to do. Again, turning to the professionals. Venus took action and started to begin raising money immediately towards screening and testing. So I'll always forever be thankful to Venus for her leadership in that. I have to also thank Teresa Lovelady and Health Corps Clinic. We talk about our plan as the Lovelady plan, but Teresa has been at the table and so has Health Corps since the beginning. Amy Finder and Tara Hunt at Hunter Health Clinic, Philip Brownlee and the Medical Society of Wichita, Project Access, Dr. Elizabeth Abla and Dr. Michelle Redmond at KU Med School, Dr. Maurice Duggins, we love you, Ed O'Malley and the team at Kansas Health Foundation, and our former District 4 County Commissioner Lacey Cruz, and of course our current Commissioner and Chair Ryan Beatty at Sedgwick County. And as an aside, I am forever grateful, and I didn't tell him I was going to say this, to Ryan Beatty. Ryan Beatty kept his promise that when he heard about this, he came to the meetings. He said he would be here every step of the way, and he's been by my side every step of the way. So I'm grateful to you, Ryan. Today does not happen without the folks that I talked about and many others who stepped up in this community to help. So with that, I want to introduce our chairman, Ryan Beatty, to share a few words with you as well.
Well, thank you, Councilman Johnson. I echo all those thanks and all the organizations and the individuals that he mentioned. I would also add a few extra special thanks to the community members that continually push for broader awareness and action. People like Ajane Bennett, people like Levanta Williams, and many others. Thank you for your advocacy. I'd also like to thank the staff of Sedgwick County government, City of Wichita government, City Council member Michael Heisel's here, all of the council, and my colleagues at the County Commission for supporting what we needed to do to make this happen. Councilmember Johnson mentioned it, but I'd also like to second the thought of thanking Dr. Elizabeth Abla from KU Med, who has spent countless hours advising on this approach, educating me personally, and a lot of other people on water contamination, as well as the health clinics that are doing all this work in the trenches, serving the people. Again, I'll second what Councilmember Johnson said. I want to thank you, Ed, and your team from the Kansas Health Foundation. You have led in a very unique way in this, and all the partners that have come on board. Thank you to all of you. Lastly, I want to thank our state partners, and I want to thank the governor's office. You led on this in a big way to secure funding, and a lot of funding at that. There have been a lot of conversations, and the state took leadership in this in many ways to get this funding started, and you deserve the credit, and you deserve our heartfelt thanks for that work. And lastly, I do want to thank Councilmember Johnson. Countless hours, countless conversations, and this is evidence that we can come together to do big things in this community. So thank you, sir, for your leadership. I never can express the gratitude I have for these individuals and these organizations. The collaboration on this issue has been remarkable, and in many ways it has been inspiring. It's been difficult at times, but complex issues are difficult to solve, and difficult conversations are going to happen. It took time to get a plan together that truly impacted the problems we aim to solve, but what came of this effort is a demonstration of meaningful change and response to a very complex community issue. Today is not the ultimate end-all solution. Please understand this. Without a doubt, this plan does represent systemic progress, but all of that work and all of us that has done this work and work closely in this situation, everyone is very much aware that you cannot just erase the damage that has been done. The damage in the contaminated plume areas, or the damaged trust and confidence of the people that have been impacted. There is still frustration and there is still concern, and we need to acknowledge that. But we also very much need to acknowledge that today is a step forward and a measure of justice is happening. And today we can demonstrate that we're not just going to turn our heads and ignore the voices of the people that desperately need action on these issues. In mid-2022, when the public started becoming aware of this situation at 29th and Grove and the contamination plume, and become aware that for 40 years there had been poison under the feet of people that lived in that community. I remember those initial town halls. I remember listening to the people's questions. I remember watching their faces as they learned more about the scale of this contamination. You could hear the fear. You could hear their anxiousness. You could see the desperation. It was an experience that on a personal level, I'm not going to forget. I'll never forget the looks on their faces and the things that we heard. It was those moments that I think many people in this room knew that we couldn't stop until we made progress. That people needed solutions and they needed action. So in many ways, I really am proud of where we're at today. Many, many months of meetings and planning and raising support have brought us to a point of accomplishment. People in this community who fear the health effects of contaminated water will have options for testing long into the future. But please know that we're not done here. We're not done here. What this experience has taught me, what it's taught Councilmember Johnson, is there's room for improvement of how these systems work to educate and protect people all across Sedgwick County that are impacted by contaminated water. This problem is not isolated. In fact, it's rather broad and it's rather complex. And we will continue to push the reforms that help streamline both the services and the communications to the public. That way everyone knows the type of quality of water that is beneath their feet. So across our community and across our state, I know these discussions about water are necessary. I know they're important and they're happening. We're talking about drought, we're talking about conservation, innovation, we're talking about contamination. Myself and others in Wichita and Sedgwick County are determined to lead in these conversations and help demonstrate the potential and the power of collaboration that can happen on the local level. So with that, I want to thank you for being here today. I want to thank all those people that have been involved in this process and getting us to this point. I think right now, Councilmember Johnson and I are willing to take some questions and help provide some clarity.
I know that you had several different organizations that kind of pulled together funding, and when we were talking about it, I think a couple months ago, you guys were saying that the Kansas Health Foundation was pitching in, but you didn't know kind of how much they would give and where else to get money. So how did all those funding pieces end up coming together?
Yeah, some of those questions Ed O'Malley, I'm sure, would be happy to stick around and answer some of these questions from the Kansas Health Foundation, but let me just give you just the rundown of what we've got to get to $3.5 million. And as many people may remember, the proviso from the state legislature guaranteed $1.5 million, but then it also allowed for more money if a match was raised on the local level. Let me just list to you what this, all the individuals and all the organizations that were involved here. The state of Kansas, altogether, $2.5 million. Kansas Health Foundation, $500,000. City of Wichita, $125,000. Sedgwick County, $125,000. The Wichita Foundation, $100,000. Fidelity Bank, $50,000. Blue Cross Blue Shield of Kansas, $50,000. Stand Together Foundation, $35,000. And the Sunflower Foundation, $15,000. That's the culmination that unlocks the match and gets us to $3.5 million total.
And I would just add to that, how it came to be was, as we were talking through with the health organizations about some of the struggles that they were facing initially with screening and testing, we knew we needed some type of plan that was going to be more inclusive than that, more sustainable than that going forward. And as we were talking, I can't remember when we first talked, it might have been December or November, sometime in there. We knew we had funding, but we knew we only had funding if we had a plan that was sustainable. It wasn't just going to be screening and testing. It had to be something that would last for multiple years, serve a lot of people. And a lot of that comes through, we won't stay here for hours today, but just the challenges we heard about. What about the folks who lived in the Plume area and moved to the west side of town or moved out of state, who might want to know about that? If somebody just finds out, do they have to go through some strenuous process, or can we just make a way for them to come get a test? And we were thinking years down the line. We didn't want to think within just 365 days, because we learned that you need multiple tests. It's not just one. You can't just take one test and know if you're good or not. When you've been exposed to this, you need to have an annual test. And if you have any signs of it, you need to have 2 tests a year. So we wanted to find a solution working together that was going to be sustainable over time, that would allow people to take multiple tests and different types of tests that they needed to show if they had kidney or liver cancer.
said in your remarks that this is a big step forward for justice, and it certainly is, but what happens next? Where do things go from here?
Yeah. Okay. So at this point in time, there was an MOU that came down from the state, from KDHE. A lot of conversations with legislators, a lot of conversations with the governor's office, the KDHE secretary, of trying to understand that MOU and what was expected of Sedgwick County in particular. There were adjustments that were made in the MOU. There were significant discussions that had taken place as to, hey, how do we actually do the systemic change that's needed to make sure that this when this money does run out at some point, that we can continue to do testing for people that have needs and have fears and have questions and concerns. Listen, if you're in a contaminated plume, be it in 29th and Grove or anywhere else in Sedgwick County, there's over 220 active contamination sites in Sedgwick County. If you have insurance, you have options. You can go to your family practice physician, you can go do, and you can get tests. What this was really trying to do is be inclusive in a way to where everyone, despite your condition, despite your situation, despite whether having insurance or not, despite your financial condition, that you can have access to a test. That was the discussion. That's what we believe this is going to resolve. And now what's happened is, now Sedgwick County government has worked through this and entered into an agreement with the Kansas Health Foundation to administer the grant. The dates on the grant will be June 1st is when the grant program will officially open. If you have questions on that grant program and the specifics, you can always go to kansashealth.org. So June 1st is when the timeline opens. July 15th, the grant program will close and applications will be submitted. August 31st, grant recipients are going to be publicly announced. And October 30th, all grants funds will be dispersed. And you'll be able to read what that RFP and what the expectations of those that will be applying. There are significant expectations of their capacity to be able to perform the type of testing that we need. So this is going to be a well thought out, well-rounded approach. The Kansas Health Foundation will be at the table. There's also an advisory group that is being formed to help advise on this process and to help provide insight. Many people, some in this room, are serving on that. I will myself and Councilmember Johnson. We have members from the state legislature, members from the community that will be serving on this advisory council to make sure that that these dollars, these grant dollars, are not just being deployed appropriately, but they're being deployed in a way that's impactful and accomplishing exactly what they were designed to do.
You mentioned there's multiple contamination sites in Sedgwick County. Does that mean anyone living near any contamination site can come get tested, or is this mainly for the citizens living near 29th?
That is a great question. These dollars from the proviso were intended to have a focus on 29th and Grove. Please understand that. They were intended to have a focus on 29th and Grove. As we begin to work through this process and develop a plan, it was widely acknowledged that 29th and Grove contamination plume is not the only situation where vulnerable people are exposed to dangerous chemicals and groundwater contamination. What we tried to do is design a system to where the community, despite where you are, whether you lived in 29th and Grove previously and have moved out, or whether you're another part of a community in Sedgwick County, that there is a plan that we can target and focus the efforts of this is how you can get tested for these significant concerns that you have. So there hasn't been much conversation with other impacted areas because the focus has been 29th and Grove. That was the focus of the proviso, that was the focus of the legislative intent, and that was the focus of our discussions in the room. But we were trying to build a system that had a wide scope and scale so that we can really deal with contamination issues in a real way. So.
When you're talking about building a system, do you mean, I know that you guys are talking about actually buying testing equipment, setting it up, everything like that. And I know that you've talked about talking with Dr. Alba a little bit about the wider contamination sites in the county. Do you see this as something where, like, in the future, you could potentially test people at other contamination sites using the equipment that you're buying with this money?
That could be a possibility in the future, but again, our focus is 29th and Grove. There has been conversation in the legislature about those other sites, and I think there's a hope that this will be able to serve that. And the way this is built out, it can, but our focus right now is 29th and Grove. It's been too long for the residents in the Plume area that haven't had the answers that they need. This is the focus. It's everything we talk about, but we all acknowledge that this will be set up in a way that could serve those other areas in the future.
Can you talk, oh, sorry, go ahead.
When do you hope the first grant-funded test will be administered? what's your timeline, given, those steps that you talked about?
Yeah. A couple thoughts on that. The first is tests have occurred in the community up to this point. I think it's important to acknowledge that. At the end of 2023, with the help of GraceMed and some of the funds dispersed there, Kansas Health Foundation actually raised $400,000 to disperse into the community with some grant dollars to make sure that the clinics could have some capacity to do testing. That experience, we learned a lot from that experience, and that's what helped really craft what we're trying to do here. Of that $400,000, only around $33,000 was actually used, and it only served about 73 patients. So there were some challenges there. The challenge was in the messaging, in the communication. Not enough people knew what was happening. There were challenges at the clinics. They didn't have the infrastructure for the reporting, and they didn't have the bandwidth. And so part of the discussion here was, how do we systemically build the bandwidth so that the clinics that will be doing this work long into the future are equipped to do that? So that was part of the discussion that really led into some of these actions and some of the plan that we were trying to build.
Do you know roughly numbers-wise how many people were affected by this over time?
So we have been working off of, there's 2,700 households in the plume. We estimated in the thousands. I think the lowest number we talked about was 20,000. But when you think about over 40, almost 50 years, I mean, that's a lot of people in and out, from homeowners to renters. And again, we still don't know how long exposure is that will cause something. So we've estimated in the tens of thousands at least. Don't see any other media questions, any public questions? That's not Mr. Barnes?
Well, I have to ask a question here.
Please.
So, I guess for the data that helps us support this in here, and the communication efforts. So guys, this is what I visualize. Most of this plenum area in here, it butts up or intersects or cross sections many neighborhood associations. Most of those associations are about 3,000 people, 800 homes.
Mm-hmm.
And trying to identify those because of property owners or renters have gone. Most of the area in which you're wanting to test now, these are 78% renters. And so I guess I'm trying to see how are we systematically going about identifying here, when I think it's pretty relatively simple. I think when you're saying here that we still got affected property, affected people in here, and this will go on for some time in here, then the people who live there, the people who own property in there, but they may not live there, I think, that 70-cent postcard out telling the property owner on state, on county record that your property has been identified in this plenum in here and it adversely affects the property value that you have, contact us at this number. I guarantee you, whether they live there or people have rented there or still there, when you tell them that it's affected their property value and their renters coming in here, you send it out to them, you will get notified about who lived there, who hasn't lived there, and how you may be able to contact them. But you gotta start with the base, wide sweep of who owns the property there to find out whether they're renters or whether there's others in here. And if they have current renters, how long this thing goes on. But I think it's pretty systematic, wide sweep of just getting that information out there. For less than $5,000, you've got about 6 neighborhood associations that fall within that plenum in here. 70-cent postcard out to those on record in here. It's less than $5,000 to help you establish a base and a point of beginning. Communication has been a big issue for you. It is not, and you've not yet to do it. Just in the plenum and the areas that come up here in the proximity of this thing here, this room should be full. We've got more newscasts and people in here and representatives here than people who are actually living in the area who may be affected and don't even know. Property owners don't even know their property's being devalued or the things of nature. So somewhere you need to start collecting that database of how do we communicate to them. You've done all the things to put it in place. You put the mechanism and the tools to test them. You got the seed money to get it going in here, but the people that don't know about it, that tells you just what you have in here, this room here, and if you've only got 70-something people who actually responded, you're not doing a well enough job of communicating to the residents and citizens.
So I definitely appreciate that, Mr. Barnes. I will tell you, though, we will add that to our comms plan. So there's going to be a collective communications plan, as well as each clinic has the ability to have communications. But to that point, more so than just a postcard. So I've knocked all those doors. I've knocked every door from 13th Street. We put flyers. We'll be doing geofence. Every possible way we can communicate with people, we will, to reach them, whether they use digital media, whether they need a phone call, whether they need somebody at their door. And on the committee that we've talked about, we actually have neighborhood presidents that will be advising us on how to communicate with their neighborhoods. So we are going to take every single way possible to communicate with people and reach them where they are.
So when I come back to the point where you say, well, we're out knocking on doors, we're giving the neighborhood association presidents, you're all very aware when you go to the neighborhood associations in here, there are meetings in here, you may have 2% of the 3,000 people who live in that neighborhood at the meeting. Most of those are long-term, and there people who live in these neighborhoods in here, very few of them come to the meetings themselves. That's not a reflection of the neighborhood associations, but just the participation. So just getting that word out and knocking on doors, and the renter answers, and he doesn't have a clue about it or how it affects him. All he just picks up and do it move. But when you have a property owner that owns a property that you're telling us in a jeopardized area, I guarantee you sent this postcard out and tell somebody, you are now in a flood zone. And you need to contact us to see what action we can take to help you. I think you'll get some response.
I think we're saying the same thing. I said we're going to do any and everything we can to communicate to everyone, renter or property owner. So all of that will happen.
You said this often enough, and everybody takes this information back, but I've yet to get the postcard. That's what I'm saying.
Okay. So this plan, as we just announced today, is beginning. That wasn't the old plan. The old plan was telling everybody that, hey, we know about this. From 2022 up until we started talking about real dollars last year, and with the Health Foundation dollars, we were door knocking. And it wasn't just, hey, here's a flyer. It was the groundwater and soil is contaminated. There could potentially be air contamination in your home. This is serious. You need to get tested. These are these places. As we said, with the dollars that we can to have actual comms with the city and the county participating in that, we will use any and all methods to reach everyone, property owner or renter, folks who go to schools. We've talked to USD 259. We are going to communicate with any and everyone about this. It's not going to be just one size fits all.
You know, I appreciate that. I just want to reiterate in here that I own a property that fits in that property zone, had it since '82. You know, and I've never lived in the property. I have tenants who've lived in it. And when this came of notification that this was going on, any records of tenants I've had that have lived there, I've reached out to them and contacted them to get in touch with this thing. So there's methods, but when you said knocking on doors, many of the homes and properties that are over in this area now here, people that own them, they don't live
I
there.
think you're focusing on one thing I said. Again, any and every way possible. Ms. Levanta.
In a sense, I think I feel even more afraid now than I have ever before. I think I'd like to know if we're saying that October 25 is where the funds stop, is that correct?
No, October 30th is when the funds get dispersed, and they'll go,
October
yep,
30th
yes,
to be
correct.
dispersed. I'm thinking about, and I'd like to know, and I will check with health people, does this contaminant infection lay dormant in your body for a while? And I'm asking that because just this week, we had a person pass kidney failure, kidney cancer, and that scared me. Along with 4 sisters who passed within 3 months of each other from cancer. Now, this is beginning to scare me because is it that it lays dormant all that time? The people that passed were in the 19 and 1800 block Minnesota, Minneapolis, one of those minis.
Yes.
That now brings me a huge concern, because in a sense, we also need to reach out to those that are there now, but I hope we reach out to those that are in those 60, 70, to 80-year-old people.
We don't have the professionals to answer that right now, but we will make sure those questions get out there. I will tell you, again, one of our conversations we had was that you need multiple tests because you may pass one test and then the next year you actually show a sign. So that's why we want to make sure we encourage people to just go annually and get tested, just so you know.
And those test after test after test, is that their responsibility? Is that where they need to look for insurance? How does that look to you?
I'm pretty sure those clinics do a really good job of tracking who comes in and out. They will probably reach out and remind, hey, you got an annual checkup coming. Teresa, you want
I was gonna say, thank you guys so very much for your concern, Mr. Burris and Ms. Lavonta. One of the things that we struggled with was especially finding out about this from the medical, Teresa Lilly.
Teresa, come on up here, yeah,
Oh, sorry.
it's okay.
Sorry, was rocking the block earlier today, having to have some humanity,
You're
but.
good. You're good.
Oh, so one of our concerns was that if it's only a one-time test, we could screen, give you a one-time test, kind of like COVID, you're done, you're positive, you're negative. Because of the impact that this social injustice has had on our community, we needed to take the time and be intentional about building the infrastructure so that if anybody wanted a test, if you were brave enough to come and say, I think I might have been impacted, then not only can you get a test today, but then you have the medical follow-up of someone that's going to be your primary care support person through this process, your primary care medical provider, that could then put you on a protocol that says, based on your screening, based on your lab work, based on your MRI or whatever that was, this is the protocol that you're going to have to follow. And the community health centers, Health Corps Clinic, Grace Med, Hunter Health, and Holy Family, and Project Access, we're working together to make certain that nobody's left behind. Because it is tough. If this has happened to you and all of a sudden you get a test and you get a one-time test, and then where are you going to take that, and then you get another test from another provider. So we will set the protocols up within our systems to make certain we're providing routine care to our patients. And even if there's something else that comes up, they are now connected to a healthcare provider. There are also behavioral health concerns, and each of those health centers have the opportunity to provide behavioral health support as well. Because we talked about families who have lost loved ones, and if it's laying dormant in your body, and how do we translate the confusion that's around what has happened to our community. So we are committed to making certain that we provide the support that's needed. We won't cover everything and everybody, and we'll learn through the process and as we work through this, but I truly feel, as a community health center that has been serving its community for over 30 years, and now finding that this injustice has impacted a lot of the lives of the individuals who have walked through those doors without health insurance, and we had no idea why, but we knew that there were health disparities in this community. But now to name it now, and to be able to address it now, and to have the support of the individuals in this room, that we're going to keep a focus on making certain that our community gets healthy, stays healthy, and they have the support that they need.
That's good, Teresa, thank you.
Okay, thank you.
Just as we're talking about the funding right now going to building this system, eventually these dollars run out. And I'm wondering if you see the city of Wichita and Sedgwick County continuing to invest in this area in the future, or if that energy will be shifted to some of the community partners that you've gathered for this effort today.
Start, I'll finish.
I mean, this is a community problem,
Yes.
so it's going to take us all. We tried to work out a plan that was based on the funding that was available. As more challenges grow, I'm sure that there will be more conversations with the city, county, and there may even be something with the state at some point. We need to get this plan implemented, but there's a lot of challenges in the community. I mean, we're talking about PCE and TCE from this spill, but you have the highest asthma rates in 214, that's in the Plume area. You've got low birth weights, you've got high infant mortality. I mean, there's a lot of issues there. So I know that this is going to go towards addressing this issue right now. The clinics who choose to get the equipment and also do the one-time testing momentarily until that comes up, I mean, we'll have a lot of answers from there. Glad KU Med is helping with tracking the data of all of this to see what those problems might be. But I can't say that this is going to be a one-time thing and that nobody's ever going to come back and talk to any level of government. There's a lot of issues that are not only in this area, but several areas. So right now, this will be our focus. There probably won't be a lot more conversations around that. We've allocated dollars toward it. We want to make sure we do the work to make sure it's implemented correctly and impacts as many people as possible. But as this happens, I'm sure we'll identify some other issues and it'll be worth a conversation.
I would add that the intent of this plan was to outlive the dollars, to build a system that could outlive dollars. But one of the things that we've learned in this process is that there really needs to be reform in how we deal with water contamination and contamination issues, and how we communicate to the public, how we do remediation, how we And what we've seen in this process is whether you have from the state and KDHE, then you have the Environmental Health Department from the city of Wichita, then the county has the Public Health Department, and these systems are not talking. These systems are not collaborating and communicating in a way that's effective. And this is why gaps happen, and this is why we've seen the communication be as poor as it was. I mean, there were people that knew of this spill for 40 years, but yet the previous council member didn't know, the current council member didn't know, my predecessor on the county commission didn't know, the state representatives of this area did not know, and I never knew. So there's a serious lack of communication, a failure in this regard that we have to deal with from the government side of things to make sure, and those are separate conversations, but the idea here is to build a system that can outlive dollars and make sure that we are serving those that are in the most desperate need. So one more question, I believe? Okay, we'll do one more question, then we're happy to stick around too and visit if need be.
Going once.
Okay,
I got a question.
yes ma'am?
Well, I don't know if it's a question, but we have established that there's over tens of thousands of people that have been affected in 29th and Grove contamination from just the TCE alone. Nothing to do with the TCE, that's a whole separate issue.
Yeah.
Just that one thing. We also established that legislation intent was for that entire amount of 2.5 million to be utilized for the 29th and Grove families and individuals that have been impacted. But now I'm hearing that because of the 210 active contaminant sites in our county, that it is going to be applied to the entire county. That concerns me.
Sure.
My question is this: out of those 210, how many of them have tens of thousands of people that have been affected, that it has been hidden for 50 years, over almost a half a century? How can you compare this
Sure.
to that?
Yeah, that's a great,
A lot of those 210 contaminant sites are as simple as a bucket of kerosene being spilled somewhere it shouldn't have been.
sure.
We know,
Yeah,
it,
yes.
but the community needs to know.
Yeah, that's, Janae, that's a great question.
So I have a concern.
Yeah, and those concerns are merited. They're conversations, multiple conversations that we've had. I want to be very, very clear that we are sticking to the legislative intent that was developed in the proviso that gears us towards 29th and Grove. What we also wanted to do was to create a program and a system that was so low barrier that they didn't have to walk into the health core clinic and fill out a form to prove that they lived in 29th and Grove. The conversation is we want to be able to set up a system that will outlive the dollars that have been appropriated to where anyone in this community, whether you touch 29th and Grove or not, doesn't have to come in and prove that your residency was at 29th and Grove.
Well, I appreciate everything.
Yes,
that
I know you do.
Everybody is doing. It kind of all started, it was just devastating when I found out what had happened to my
Yes.
community. And I do appreciate Grace Med most of all, because they jumped in immediately. I appreciate Hunter and Health Board, but as a person that was involved in the testing from the beginning, I didn't have to prove where I lived. When I went to Grace Med, that wasn't necessary. So I'm sure we'll work all that out, but that should not have been a problem.
Right. Yeah, when it comes to the systems happening at the health clinic, that was part of the discussion, is not only just having the capacity to do the type of testing and the follow-up testing, but also the reporting that's going to be required to represent this. So I'll tell you what, we appreciate the media coverage. We appreciate you helping to tell this story. It's a big part of what this is and why we're here today. Councilmember Johnson and I are happy to stick around, and I know there's other people in the room that are also here that are happy to be able to take comments and questions and help again to really get the information out about what's happening here. Again, special thanks to all those individuals we referenced earlier. Councilmember Johnson, anything else?
Thank you all for
Okay,
being here.
Thank you very much. Appreciate you.